Welcome, everybody. So tonight we'll be talking about the health of your brain, present and future. More importantly, your future health. I'm Dr. Steve Tashiro, and I'll be hosting this conversation. And a bit about my background. I've worked in healthcare now for 40 years. My first degree in health sciences is a master's in nutrition from the University of Bridgeport in Connecticut, 1984. I helped people for many years through the venue of nutrition, helping with their body chemistry. And then I graduated from Palmer Chiropractic College in 1998, and that training gave me the background for understanding how the brain and the nervous system affect and ultimately regulate the rest of the body. So the information we're sharing tonight is a synthesis of all of that information and training. We'll be talking about an approach to care called neurometabolic care. So the neuro refers to what we do to help improve the function of the brain and the nervous system. The metabolic side refers to body chemistry. We do a lot of workshops in this office, but the brain seminar is one that I'm most interested in. Partly because my parents came to live with me when they were in their later years. During the course of 5 years that they were with me before they passed, I saw their personalities change dramatically. When they arrived, they were in the early stages of dementia, and when they passed, they were in the thick of dementia. It's pretty sad to see how a person's whole demeanor and being changes because of dementia or Alzheimer's. And what's especially sad is that almost all of that, I'd say all of that, can be prevented. This is not just a development that occurs over the course of a few months or even a year. It occurs over the course of years and years and years of deterioration. Unfortunately, in today's conventional healthcare approach, there's not a lot of training about how to spot and address the early signs of brain degeneration. Even in the alternative field, there aren't too many that are set up to do that. One of the main purposes for tonight's talk is to give you the tools that you need in order to understand how your brain works and to spot the signs of it not working. My attitude about health and our bodies is that our bodies are at least as important as the cars we drive. And yet, it's amazing to me in talking to people that most people don't have even the most fundamental understanding or information about how their body works and some of the signs of their body not working like it should. If you're driving down the highway in your vehicle and you feel the steering wheel starting to shake and the vehicle starts veering off to the right, Vijay, what would you say that's a sign of? Yeah, alignment. Yeah, so the alignment is off. So most people would answer that question in the same way. Asked a similar question about the function of their body and the initial stages of a deterioration in that, most people would be clueless about what a common symptom is signaling. This is all about educating ourselves so that we are on more friendly terms with our bodies. And that's especially important when it comes to the function of the brain, because ultimately your brain is what controls everything else. We send out email newsletters, and we also do a lot of these talks. So if you'd like to be informed of our talks and to receive educational information via newsletter, just write your information on this blue sheet and give it to Lisa when you leave. The next page is a summary of educational requirements for doctors of chiropractic compared to doctors of medicine. A lot of people just aren't aware of the education and training required for chiropractors. It's especially important to be aware of this as we go through information about brain function. The picture that people have of chiropractors is that we crack backs. And we do some of that, but there's so much more to it. Look at the bottom of the left-hand column, and you can see that in chiropractic education, total hours required is 2,419 compared to 2,047 in medical school. The distribution of these hours is very different because of the huge difference in philosophy between medicine and chiropractic and other alternative forms of healthcare. Medicine is the study, the diagnosis, and treatment of disease and illness through drugs and surgery. And healthcare and medicine these days is extremely specialized. So if you have a problem with the function of your GI system, you go to a gastroenterologist. And he has detailed, in-depth training about the whole GI system. And that's great to have that resource available, but unfortunately what tends to be lost in this extreme specialization is the fact that everything in your body works together and nothing works in isolation, separate from the rest of the body. And this fact becomes painfully apparent when it comes to chronic conditions, because no chronic condition in your body, whether it's diabetes or a poor thyroid function, deterioration of the brain, a chronic gastrointestinal problem, none of that occurs in isolation from the rest of the body. And in order to recover from a chronic condition, you have to understand the various relationships between the ailing part and all the other parts that affect it. So what I'm talking about is what we call physiology. That's how the body functions in a state of health. In order to understand how a person got to the point of dysfunction, a disease, for example, you have to understand where they started in a state of health and what process did they go through as they lost that optimal function. And that's why in chiropractic training, physiology is heavily weighted, 243 hours compared to 174 in medicine. As I said, medicine's all about diagnosis and treatment of pathology, disease, and that's why in medical school there's 507 hours given to that topic. Alternative care is all about, again, understanding the holism of the body. Here we have one integrated unit, and we have to understand the relationship between those parts. And that's what anatomy and embryology refers to. Embryology is how the human organism develops from the union of the sperm and the ova and goes through differentiation. If we understand the various stages in embryology, we begin to understand the relationships in the mature body of organ system to organ system. So as the embryo is developing, there are certain tissues that develop at the same time. And the term we use to describe that is tissues that are wired together. They come out of the same embryological tissue. One example would be the part of the brain called the cerebellum, which is back here. That's all about accuracy of movement, balance, and coordination. So that is wired at the same time as a part of the brainstem called the pons. The pons is the birthplace, you might say, of certain nerves that regulate functions throughout the body. One of the important ones is called the vagus nerve, cranial nerve 10. The vagus nerve ultimately regulates all visceral or organ function. Heart, lungs, bowel, bladder, GI function. That's all controlled by this vagus nerve. So knowing that, and knowing that the vagus nerve comes out of the pons, which is born out of the same tissue as the cerebellum, if a person has a problem with GI function, we can actually help that by improving or stimulating the function of the cerebellum. If a person has problems with cerebellum function, in other words, they have problems with balance, they get dizzy, vertigo, they have problems with coordination. When we do the finger to nose test, touching the finger to the nose with the eyes closed, they touch their ear or they touch the opposite side of the face. That could be cerebellum, or if the movement is jerky. So those are all signs of possible cerebellum dysfunction. Well, knowing that the cerebellum and the pons are born on the same day and they're not only wired together but they fire together, we can help the cerebellum by stimulating the nerves that come out of the pons. So what do those nerves do? Well, I said one of them controls visceral function, but another one of those nerves controls the muscles that we swallow with. So you can help cerebellum function by gargling. So anytime you're brushing your teeth, take a mouthful of water, tilt your head back, and not just like a dainty ladylike gargle, but very vigorously gargle. And do that as long as you can. Another nerve that comes out of that pons area, it's actually a little lower than medulla, regulates the gag reflex. So if you want to help your cerebellum, just take your toothbrush right after you've gargled and stick it to the back of your throat and make yourself gag, a light gag reflex. That's actually a very powerful stimulation to that nerve. And again, because of the association out of the same embryological tissue, you stimulate the cerebellum. Someone comes in with chronic GI function problems, so we don't just look at the stomach and prescribe an antacid because they can't digest their food. We have to step back from the symptom, understand the holism of the body, and understand the ways by which we can affect that area in a positive fashion. So with that example, we could do exercises that activate the cerebellum, like standing on one leg, balance, moving the arm, complex nonlinear movement it's called, firing off the cerebellum. Actually, you would do that, stand on the leg and move the arm on the same side. This is stimulating my right cerebellum. So that's activating the pontomedullary area, which gives rise to those nerves, including the one that regulates GI function. And so that's why in chiropractic school there's so much time, 456 hours spent in anatomy and embryology. I want you to look at what the brain looks like when it's healthy, but also when it's not healthy. In the left hemisphere, or half of the brain, is what we consider to be normal architecture. In the right half, we consider to be abnormal architecture. There's less tissue on the right side compared to the left. The spaces between the folds of tissue are bigger on the right side. And this is a real good illustration of the fact that as the brain deteriorates, it actually shrinks and becomes smaller. Some gross examples would be, you know, the medication that is used for people with ADHD, like Ritalin? So by the way, that's a class 2 narcotic, just like cocaine. It's what's called a central stimulant. It stimulates the nervous system. Studies that were done on that followed the users of Ritalin over the course of 1 year and found that behavior improved over that period of time. And so that's the study you hear about when Ritalin is touted as a remedy for ADHD. What's not disclosed is the same research team, so University of California, followed those Ritalin users for an additional 2 years. And what they found was after that first year, there was an effect on the size of the brain. It actually decreased the brain volume. By year 3, those who continued to use Ritalin had a significantly increased risk of drug abuse for the rest of their life and addiction to smoking, but primarily drug addiction. And so that's not a very good payoff. Chronic pain will shrink the brain by volume. And people that become inactive and don't move around stop activating the nerves that feed the brain, and so their brains start shrinking. So that's why when the astronauts go in space, they can't keep them up there very long because this starts happening to their brain because they're not in a gravity environment. And one of the greatest stimulants to brain function is all of the adaptations that our muscles and joints go through just to be upright in gravity. So in a gravity-free environment, you don't have that stimulation, so the brain actually shrinks. And what we'll be talking about tonight is how the brain shrinks in dementia and Alzheimer's because of various lifestyle issues that all can be managed. Next page is a side view of the brain. We'll be labeling the parts of the brain and talking about the function of each area. Then the next page is the most important page in the packet. If you do a bad job with these issues, you're going to have a deteriorated brain. Your brain is going to be crap. Earlier this week, I spoke with a gentleman who is not that old. He's in his 80s, I believe. And the MRI showed that he has white lesions, plaquing in his brain. And the MRI report states that that is secondary to what's called ischemic FARCs, meaning small clots in the blood vessels of the brain. So he's got inflammation in his brain, and it's secondary to his elevated blood sugar levels. So this gentleman has diabetes. That's one of the most inflammatory processes that you can have in your body, because the sugar combines with other substances and they form what are called glycosylated end products that have a tremendously inflammatory effect in the body. So that's why Alzheimer's is called type 3 diabetes, because if you have diabetes, it's almost guaranteed you're going to have accelerated neuronal breakdown and deterioration. It's not just blood sugar, that's just item number one on the list. There's a lot of other items. And then follows some very happy stories about people that came to our office through the years with various types of neurological and brain problems. The first one, David, he had dyslexia, trouble reading, couldn't write because of difficulties distinguishing left from right. The next one, Mike, had all the symptoms of ADHD, and he recovered from that, but that's where he was at when he first came in. The next gal, vertigo. Zelfa, the last one, sweet lady, she's 85. When she first came in, she had extremely poor balance, extreme fatigue, extreme brain fog. And if she continued in that path, it would not be much longer, I believe, before she would have had to go into a assisted living kind of situation. She has no family, so she realizes that she's got to do everything possible to stay functional. Going through a period of care, she states she's about 80% improved. Now she comes in on a monthly basis just to maintain that higher level of function. On the next page, Joan, dizziness from inner ear problems. Next gal, brain fog, poor balance, sugar cravings, compulsive eating. So there's an inescapable intimate relationship between body chemistry and brain function. The next gal, Lydia, lifelong vertigo and dizziness and nausea. And then Joan came in following a stroke. She'd lost full function of her left arm. The next page, the first two are vertigo. The next one, vertigo, balance problems, tingling in the extremities, drop left foot, concentration, memory. And the last one is poor balance. So you can see that the manifestation of a decline in the function of your central nervous system can take many forms. And our goal here tonight is to understand just the basic fundamental issues affecting brain function. If you're not doing a good job with those basic issues that are listed on that list that I showed you, the deterioration of your brain and nervous system can follow any number of paths. If you're younger, dyslexia, ADHD, autism. If you're nearing the later part of your life, that's when we call it dementia and Alzheimer's. The material we'll be covering tonight is applicable to any brain nervous system deterioration, no matter what it is. In alternative care, we like to get as much as possible away from labels, diagnoses. Diagnoses really are part of the structure of pharmaceutical-based acute medical care. In order to get paid for their services, conventional healthcare practitioners, i.e. medical doctors, need a diagnosis. Insurance companies only pay for recognized diagnoses. So if you have a diagnosis, then I can write a prescription for that and I'll get paid for it. The focus is on isolating the problematic tissue. Create a diagnosis, write a prescription, do a surgical procedure, and we'll get paid for it. A main point in tonight's conversation will be the fact that a chronic condition doesn't just have one tissue of origination, because the body is holistic. If what I've said makes sense and you feel you need some assistance with your brain health and function, I'll be making an offer that allows you to receive my assistance at a greatly discounted fee for the first two visits, the evaluation. This is one of the faces of Alzheimer's. Alzheimer's, it's the most common form of dementia. There's 10 or 12 other types of dementia. This is what it looks like in the later stages, that vacant look. This gentleman probably doesn't know his name. Of course, it's not just a problem for men, women experience this as well. One reason I do this is I don't want any of you to be looking like that in 5 or 10 or 20 years. And you don't have to. There are certain places in the world where people know how to live, take care of themselves, and they age gracefully into their hundreds. One such place is a place in northern India where the Hindu people live, but not just in other countries. This is one of my mentors. He lived till he was 92, hale, hearty, and full of life and full of passion till the very day that he passed. He was a counselor and he loved his work. So he would teach other counselors. The day that he passed, he completed what he called a weekend intensive, where he gathered other counselors and he shared his wisdom through the years. Then he went home, walked home, and according to his family, he sat down on his bed in his bedroom and he kind of looked up and said, "It's time for me to leave, time for me to go home." He laid down and he was gone. I call that a graceful exit. And I hold that out as the ideal of what's really possible. Rather than being in the nursing home in a wheelchair, vegetable, on 10 or 12 medications, not recognizing your family, and maybe even verbally abusing your family when they come in because you've lost all function in your frontal lobe that's required to regulate the more primitive brainstem. And so what a huge contrast between what we've come to accept as being normal and what is really possible. One of the things about our current healthcare mentality that bothers me the most is how we've been tricked into accepting so little when so much more is possible. You go to a medical doctor or a practitioner and you talk about your brain fog, talk about fatigue, and 9 out of 10 times you'll be told you're just getting old. Meaning this is inevitable because we expect you to, like a machine that has moving parts, this is the mechanistic view, we expect you to wear out, run down, your parts will wear out, they'll have to be replaced. That's the future you're looking at. It's a totally mechanistic view. In alternative care, we recognize your body has an incredible ability to heal and self-regulate, given the proper materials and support. The way you think about the rest of your life totally determines what it's going to be. And if you continue in this very small, narrow paradigm, then that ultimately will be your experience. But you don't have to. There's options. We're going to talk about how the brain works, what causes the brain to decline, and what can be done to maximize your brain's health through integrative medicine and functional neurology. And the information that I'm sharing is from this book, Why Isn't My Brain Working?, by one of the most brilliant researchers in functional healthcare. This book is jam-packed with like 1,000 references from current research. But what he says, for the most part, you'll never hear about in mainstream healthcare. And that's because it takes years and years for the most recent developments to hit mainstream healthcare. Most doctors are 15 years behind the current research. So you won't hear what he talks about in a conventional healthcare office, although what he talks about is leading edge research. What we're talking about is what we refer to as soft lesions. The distinction between soft and hard is that a medical neurologist is looking for hard lesions through imaging and neurological tests. Hard lesions are architectural changes in the structure of the brain, like a tumor or a cyst or an aneurysm or a hemorrhage. And he, of course, treats those with medical tools, drugs, and surgery. What I look for when I do a neurological evaluation is what we call a functional or soft lesion. There's no tissue change, but the neurons aren't functioning at an optimal level, so that the patient has neurological related symptoms. We help them using functional care, not drugs or surgery, but methods to increase the vitality and functioning of those ailing neurons. What are the symptoms of a more functional problem in the brain? Well, you have a list of them on this form. This form is divided into different sections. Each section describes function problems in different parts of the brain. And these would be problems that would be present even in the absence of a tumor or a hard lesion. How prevalent are these soft brain lesions today? 1/8 of seniors eventually develops Alzheimer's. 1/8 of children eventually develop one of the various variants of autism spectrum disorders. A child that has ADHD or autism isn't likely to have something growing in their brain that's causing the behaviors that we label as ADHD. Again, what they have is a functional imbalance in the brain and in the neurons. Some startling statistics relative to autism spectrum disorders. Since 1991, the diagnoses of autism has increased by 7,000%. There are a lot of people that think that one of the key contributors to that is the fact that in 1991, the amount of vaccinations was increased twofold. There's a bunch of toxic substances in vaccines. I'm not saying that that's the only cause, but quite likely it's one of the causes. Dementia, 24 million in the world currently, expected to double by 2040. And a lot of that has to do with how extremely and increasingly toxic the environment is. Chemicals, pesticides, what's in our food, prescription medication also. Use of antidepressants, anxiety medications is increasing. And by the way, the number one cause of accidental deaths in seniors is falls. So you fall because you have poor balance, because your brain's not functioning properly, or the nerves that feed your brain have lost their sensation. You go to the hospital, you get an infection, then you die. So that's why falls is the #1 leading cause of deaths for seniors. But understand that it relates to a loss of optimal function of your brain and your nerves. So what does a healthy brain need? It needs fuel in the form of glucose or sugar and oxygen. When I tell that to patients, they say, oh, you mean I need to eat more sugar? And that's just the opposite of what's really required, and we'll talk about that. The brain needs proper brain chemicals called neurotransmitters. These are the chemicals that allow the neurons to talk to each other. Sugar regulation has a huge impact on the health of these neurotransmitters, as does gut function. So a lot of these are produced in the gut. Healthy brain needs proper activation or stimulation or exercise. And the proper brain environment is free of inflammation. Without an inflammation-free environment, your brain can't function properly. Here's a really interesting slide showing the connection between eating and the production of energy. We call that metabolism. And guess which organ consumes the most energy by far? The brain requires up to 30% of our glucose and oxygen. If we're not moving around, delivering blood to the brain through physical movement, exercise, then we're not getting fuel to the area that needs 30% of it. If our blood sugar levels are going up and down, then at times when it's low, we're depriving the part of the body that needs 30% of that fuel of its staff of life. Now we'll talk about different parts of the brain and their functions. So take out your brain diagram. The part to the left, that's labeled front. Part on the right, that's the back of your brain. All of this requires fuel and activation. This bulge under the brain, that's the brain stem. The brain stem is the point of origin of those nerves that regulate many functions, including the vagus nerve, cranial nerve 10, that regulates internal organ function. So today when we are gargling, we are stimulating the lower brain stem. We want to improve the function of cranial nerve 7, which regulates salivary secretions. This lump back here is the cerebellum. That's accuracy of movement, balance, posture, and coordination. If the cerebellum is not functioning optimally, you'll have dizziness, vertigo, problems with coordination and balance. There's other possible causes for that, but cerebellum is key. The way the brain works is 80% of the electrical activity to and from the brain is from the body to the brain. And it's essentially that flow of information from the body that keeps the brain healthy. We call it activation. So I'm just going to draw an arrow pointing up, saying 80%. And that information, that stimulation, gets to the brain through the spinal cord, and it comes into the spinal cord from the periphery through nerves. So if I come over here and stimulate the nerve in your leg, that's firing off what's called a large diameter afferent nerve, 270 miles an hour. That's how fast that signal goes. It goes up the large diameter nerve to the spinal cord. It crosses up to the brainstem, crosses over to the left side, then goes up and stimulates the left parietal lobe. And so doing this is the type of stimulation that keeps this part of your brain healthy. So the parietal lobe is the part of your brain that receives sensory input from the rest of the body. Understand a key concept here. If you have pain in your body, if it's your knee or your back, the pain is actually being perceived in your brain. So you've got knee pain. There's a part of your brain that is related to and has a map of the lower extremity, including your knee. So if we really want to get rid of knee pain, all we have to do, this is so simple, any fool would see this, all we have to do is take out the part of your brain that receives information from your knee. But you'd lose a few other functions too. Parietal lobe has a map of the whole body, and it receives sensory input from the body. The temporal lobe, just above the ear, this is for processing sound, verbal communication, smell. This is also where short-term memory occurs. And this lump back here, that's a cerebellum. In a way, that's like a second brain because its functions are so varied. This is called the occipital lobe, and that's primary visual center where visual input is processed. And then in the front, as you would expect, it's called the frontal lobe. To grossly generalize, the two major functions of the frontal lobe are motor output and cognition. My right frontal lobe is involved in voluntary motor movement on the left side of the body. but the right frontal lobe sets the resting muscle tone of muscles on the right side of the body. So there's a difference there between voluntary motor movement and resting muscle tone. The right frontal lobe, left frontal lobe too, are both involved in cognition. The frontal lobe is the most advanced part of the brain, so it makes us human. And that's what makes us different from the beasts of the field. Beasts of the field don't have the frontal lobe. They operate primarily based on instinct, and that's what is in the brain stem. So the brain stem is like the most primitive part of the brain, and the general principle is the higher centers of the brain regulate and control the lower centers of the brain. The frontal lobe is the newer part of the brain, so it regulates and controls the brain stem. As the frontal lobe declines in its function, the ability to regulate the primitive urges and drives that are primarily survival-based, coming from the brainstem, goes out the window. ADHD, for example, which involves a decrease in the electrical vitality of the frontal lobe, usually on the right side. So the child with ADHD loses the ability to regulate impulsive behavior. Just had someone in here this evening, a young boy, 6 years of age. Parents brought him in because of ADHD, very disruptive at school, become violent. When he does, he's very remorseful about it, but he just can't control his impulses, like his anger. A number of times he's actually hit his mother. After he does it, he's very remorseful, but he can't control that impulse. So he's 90% better now, because what we've been doing with him is we're managing his body chemistry, but we're also improving the function of the frontal lobe so he has better control over the primitive part of his brain. But you see it at the other end of the age spectrum as well. As human beings age and lose the function of the frontal lobe, they start losing their personality. When a patient comes in with the spouse and the patient has symptoms and signs of brain degeneration, and almost always that's accompanied by significant metabolic imbalances, body chemistry imbalances, and I'll say to the spouse, okay, she's not the same person that she was when you married her, right? Yeah, because this is our personality. And when we lose executive functions like planning, decision-making, who we are as a person, we start losing. That's one of the most sad parts about dementia and Alzheimer's is the person you loved and married is no longer the same person. And eventually become a vegetable, not recognizable. And on the questionnaires you have, it's laid out according to these lobes of the brain. So if you're wondering how your frontal lobe is doing or how your parietal lobe is doing or your cerebellum, just look at how you answer these questions. Section 1, 2, and 3 are more generic. Section 1 relates to brain endurance. Section 2 is posture and movement. And Section 3, memory and cognition. All of those functions are affected by numerous parts of the brain. But it gets more specific when you look at Section 4. Those are symptoms of temporal lobe function declining. Section 5, that's occipital lobe. Those are symptoms of the occipital lobe losing its function. Section 6, that's frontal lobe. Section 7 is parietal lobe. Section 8 is brain stem. This area right here controls organ function, so understandably, these symptoms in Section 8 relate to how your internal organs are working. Section 9 and 10, that's called the basal ganglia, and kind of like the cerebellum, that's involved in coordinating our movements, making them smooth. So if your basal ganglia is not functioning properly, you'll have similar problems with function as if the cerebellum is not functioning properly. Movement disorders like tremors or tics, or difficulty moving or difficulty controlling movement. And then Section 11, that's your cerebellum. Accuracy of movement, balance, posture, and coordination. Here's the picture of what's called the homunculus. So I was describing the fact that there's a map of your body on the surface of the brain. So this is looking at the brain from the front. So this would be the right side of the brain, this would be the left side. And then what's shown here is the brain viewed from the side. So in these side views, the left part of the brain, that's the front, and the right side is the back of the brain. You know how common back pain is in our culture, and a lot of that has to do with our postural habits from work, etc. Notice how on this map, how much space is given to the face, including the mouth. Notice how much space is given to the hand. The function of the face, mouth, lips, eyes, ears, etc., hand movements are so intricate, requires a large somatotopic representation on the surface of the brain. Notice how small the area of representation is for the lower back. And so there's an accident waiting to happen. Less control, input and output for the back because it's such a small area of the brain compared to other parts of the body. So looking at the brain from the side, this orange area is called the somatosensory strip. This is in the parietal lobe. That's where all the incoming information from these parts of the body is received. So if I stroke the skin on your back, or if I stick it with a pin, or if I heat it, all that sensory input from the back is coming into the part of this orange strip that corresponds to the back. And then the pink, this is a motor strip. And this is where the signals originate that eventually lead to motor function or movement. The way these parts work together is the sensory information comes into the parietal lobe. So let's say this is a sensory signal that started in the lower extremity, comes up to the parietal lobe. The parietal lobe processes that and then sends forward to the motor cortex a signal that ends up producing a motor response, a motor output. But understand this, if we don't have this sensory input, then we can't have a motor output. And one aspect of motor output is cognition. If you're not moving around, physically active, that's going to affect your ability to think clearly, because no sensory input decreases motor output. Let's talk now about what causes the brain to degenerate. This is that page that I pointed out that you should put on your refrigerator and grade yourself periodically on how well you're doing with these different areas. Almost all of that relates to body chemistry, which relates to lifestyle, which is changeable and manageable. This is the information that you need to take and act upon because you have huge power over future and health of your brain based on what you do relative to these areas of lifestyle. You cannot separate the health of the body from the health of the brain. Blood sugar imbalances. This is one of the areas of health that probably we do the most work with and see the greatest return from in terms of benefits to people's function. And it definitely holds true in terms of the function of the brain, because glucose and oxygen are the main source of fuel for your brain, and glucose is blood sugar, and it comes from food we eat. No matter what the food is, when it goes through the process of digestion, gets broken down, ultimately ends up in the bloodstream as glucose. There's a certain level of glucose in the serum that ensures that the brain is going to have a steady, uninterrupted supply of fuel. On your blood test results, look at glucose, and hopefully it's between 85 and 99. If it's lower than that, we call that hypoglycemia or low blood sugar. And if you have that, you're going to have headaches, irritability, fatigue between meals, depression, anxiety. You'll crave stimulants like caffeine, alcohol, sugar. And if you have the standard American diet, which is highly weighted to carbohydrates, your blood sugar level is going to be low, then high, then low, then high through the day. And when it's low, your brain is starving for lack of fuel. When it's high, you're creating those glycosylated end products that create inflammation in your brain. If we regulate blood sugar, that has a huge, huge impact on the health of your brain and your entire body. If it's above 99, 100 to 126, we call that insulin resistance. If it's above 127 or higher, we call that diabetes. And so the way we ensure that it's going to be in the optimal range is through dietary patterns. So avoiding the standard American diet, which is loaded with carbohydrates, concentrated carbohydrates, both the refined carbohydrates like white sugar, white flour, but also it's heavily weighted to grains. Even if they're whole grains, they're still very glycemic. So essentially what you want is what we call a paleo diet. A lot of vegetables, only the fruits that are not quite so sweet, fruits that have a pit or a stone, like nectarines and peaches, and then good quality protein. That's the kind of food intake that stabilizes sugar levels through the day. Who here doesn't have stress in their life? Okay, everybody does. Let's talk about the effect of stress on the brain. Stress is an unavoidable part of life, and it comes with a price if not properly managed. And that price is chronically elevated levels of the stress hormone, cortisol. And cortisol, we need it to manage stress, but severe problems develop if it's uninterrupted, unrelenting, hour after week, after day, after month, after year. What happens is it causes a fire in the brain and breaks down the protective membrane around the brain called the blood-brain barrier. Let's look at the brain side view. Of course, the bloodstream passes by the brain, and there's all kinds of material in the blood, including bad stuff like petrochemicals, viruses, parasites, bacteria. So stuff that you don't want in your brain. In a state of health, the blood-brain barrier keeps those undesirable elements from getting into the brain. But chronic prolonged stress actually degrades the integrity of this membrane. So now the openings between the cells of the membrane, which should be very, very small, get bigger and bigger and bigger. That's a portal of entry for large molecules that normally would be screened out. When those large molecules get into the brain, that's when havoc occurs. Let's say you're sensitive to gluten, the protein in wheat, but you're still eating it. Gluten gets into the environment of the brain, and it passes from the bloodstream through these abnormally large portals. And once inside the brain, the cells in the brain called microglial cells go on high alert. There's actually 9 of these microglial cells for every neuron in the brain. So they're like housekeepers. They're housekeepers with machetes and knives and guns. And if anything gets in here that shouldn't be there, they go on a rampage and they attack that substance. Again, it could be gluten, it could be a chemical, it could be a virus, parasite, and it creates a massive fire, inflammation. We call that fire in the brain. How do you know if you have a fire in your brain? Well, there's some common symptoms. Brain fog can be caused from brain inflammation. Problems with short-term memory, chronic pain, because if inflammation has gotten into your brain, it won't just be in your brain, it'll be throughout your body because it's carried. Those inflammatory immune cells are carried around in your circulation. One way to know if this is you is with what we call the GABA challenge. We like to do it with all of our patients. This is how it works. So GABA is one of the chemicals found in the brain, in the healthy brain, and it's made from smaller molecules that are able to pass through the healthy blood-brain barrier. And GABA it's called a neurotransmitter. It's the only chemical in the brain that has a calming effect. If you know, or if you're one of these people who goes to the health food store and gets GABA, and you take like 1,000 milligrams because it calms you down, automatically you know that your brain barrier has been damaged. The GABA should not get into the brain because it's too big of a molecule. So if you take GABA and you notice a change in your state, it means your brain barrier is leaky. And the change could be positive, like more energy, less stress, or it could be a negative change like more fatigue, more brain fog. Any change at all is a sign that the GABA has gotten inside your brain. Fortunately, though, there are ways to heal this lining, and they're pretty much the same things that we do to heal the lining of the intestine, the gut. Because leaky gut, which is inflammation, porosity of the intestinal membrane, is very similar to blood-brain barrier being porous and inflamed. The same proteins make up the gut lining as are present in this brain barrier. Understand that the biggest stress, though, is not emotional, but it's more biochemical. Poor diets, high in carbs and bad fats, alcohol, smoking, caffeine, eating foods you're sensitive to, anemia, meaning you're not carrying enough oxygen to the brain, infections in your gut, autoimmune disorders. That's what this is portraying. It's when your body's immune system, immune cells, are attacking and damaging healthy tissue. So this picture shows the microglial cells attacking the gluten, but in the same breath, they're actually damaging the brain itself. So that's called neurological autoimmunity. Musculoskeletal pain. I mentioned earlier that chronic pain can shrink your brain, and poor digestion, low GABA production. Another effect of the stress hormone cortisol is that it deteriorates that part of your brain. It's kind of underneath the temporal lobe. It's called the hippocampus, and that's where memory occurs, short-term memory. So if you have chronic stress, High cortisol, one of the effects of that will be a loss of short-term memory, a decline in short-term memory. High cortisol also shuts down the pituitary gland, which then can't regulate the thyroid, so weight gain and all those symptoms associated with low thyroid function. When cortisol is high for a prolonged period of time, because a person is in a chronic state of fight or flight or stress, and again, it's not just circumstantial or emotional, most of it is from imbalances in body chemistry. You'll have or develop eventually some or all of these symptoms. Symptoms of stress response that's running crazy, unregulated. High blood pressure, dry eyes, mouth, loss of taste, smell, poor digestion, constipation. Because remember the brainstem and cranial nerve 10, the vagus nerve, that gets shut down when the stress response is active. Fatigue, cold hands and feet, constriction of the blood vessels in the extremities. Frequent urination, incontinence. Erectile dysfunction, low libido, headaches, chronic pain, insomnia, hormone imbalances, sensitivity to light and sound. Now, you'll probably also recognize these as symptoms that are common in people as they grow older. And that's because, again, it's the frontal lobes that regulate the brainstem. The stress response originates in the brainstem. And if the frontal lobe is not regulating the brainstem, then that part of the brainstem starts firing at will. So it's not just a stress life situation, but it's loss of function of the frontal lobes that can lead to this chronic, unrelenting sympathetic activity, fight or flight syndrome, that leads to these symptoms that we see often in the elderly population. So here's a lady that came to our office because she had a stress response that was running out of control, extremely high levels of stress. The symptoms that it was manifesting as was foggy thinking and memory problems. Pretty stressful life situation, taking care of ailing parents, a very demanding work schedule, traveling and doing speaking. She came in because in her speaking, she was losing the ability to remember people's names, and it was very embarrassing to her. We had to stabilize the function of her brain, frontal lobe. Metabolically, body chemistry, her sugar regulation was out of control, very high levels of sugar. She had systemic inflammation. There's a substance called homocysteine that's a good marker for brain and cardiovascular inflammation, and her levels were extremely high. Her cortisol was extremely high, and so through brain therapy, exercises to stimulate the frontal lobes, and balancing her body chemistry, all of that pretty much resolved. And then she looked like this, smiling, happy lady. Another significant source of stress to the brain is the food we eat. So if we're eating food that we're actually sensitive to, the most common ones are gluten, soy, and dairy. It's creating this chain of events in our bodies that leads to tremendous taxation on the brain's function. So if we're eating food, including genetically modified food, our body doesn't necessarily recognize that as being food, sees it as foreign. So our immune system actually attacks it. The cells that do that are called cytokines. They create inflammation. They're released into the bloodstream, and those cytokines can actually cross the blood-brain barrier, react with the microglial cells, the brain's immune cells, creating inflammation in the brain. So if you're eating food that you shouldn't be, you're frying your brain. So if you have brain inflammation, and this is just one of the causes, it's like me taking this blowtorch and holding it up to your head. And that's a pretty dramatic, it's like accelerating the time frame, but that's literally what's happening if you're doing these things that we're talking about that are creating stress to your body and your brain. So we need to do the things that put out the fire and then keep it from starting again. Most common food sensitivities, gluten, dairy, and soy. How do we know if you're reactive to them? There's different ways of testing to see if you are. If you have poor gut function because of all that relationship, you'll ultimately have poor brain function. If you have poor brain function for other reasons, let's say head trauma, then the part of your brain that is involved in visceral function regulation can decline in its function, and that in itself can cause problems with gut function. So again, it works both ways. What causes poor gut function? Eating foods that you shouldn't be, chronically elevated cortisol, a leaky gut syndrome. That's again inflammation, porosity in the gut lining. Dysbiosis meaning bad combinations of bacteria in the gut, often secondary to antibiotics, different types of medication. Infections in the gut, yeast, virus, bacteria, parasites, pretty common actually, can disrupt gut function and therefore brain function. Body or gut inflammation can lead to brain inflammation, but brain inflammation can lead to body or gut inflammation. So that's something to be watching. To make sure that that doesn't show up. This is David. He's a really young guy. When he came in addition to agonizing neck and back pain, he was starting to have attention and memory problems for such a young guy. His problem was his gut was a mess, just extremely screwed up because of what he was eating, foods he was reactive to. His sugar levels were off the map, up and down. So tremendous chemical stress to his nervous system. We helped him by managing his diet, and then improving brain function, which was lost because of this chemical stress to the brain. And now he's doing great. So I showed you the flame as representing brain inflammation. Here's a summary of what causes that. Diabetes, high levels of sugar, glycosylated end products, very inflammatory for the brain. Alzheimer's is called type 3 diabetes. So if you have problems with sugar regulation, you're putting your brain at risk. High carb diets, which leads into diabetes. Poor circulation. So how do you know if you have poor circulation to your brain? Well, if you have cold extremities or a cold tip of your nose, those are signs of poor circulation. And if it's not getting here, it definitely won't be getting up here. So again, we need to keep active. Eating foods you're sensitive to, any gut inflammation, leaky gut syndrome, high cortisol, high homocysteine, that's the inflammatory chemical that causes brain degeneration and cardiovascular deterioration. And alcohol. Neurotransmitters are the chemicals that allow neurons to talk to each other. Pictured is the filament, the nerve fiber that carries a signal from one neuron so the signal can be picked up by the next neuron. And this gap is called the synapse. So the signal jumps from this neuron across the gap to the neighboring neuron. And it's neurotransmitters that are released from what's called a presynaptic neuron into the gap that allows that transmission of signal to occur. Certain medications, like Prozac, act by changing the neurotransmitter balance in this cleft. Prozac is what's called a serotonin selective reuptake inhibitor. Once serotonin, that's just one of many neurotransmitters, is released into this gap, it doesn't stay there forever. It gets broken down and it gets absorbed into the postsynaptic neuron. And then the next signal travels down the nerve fiber, more serotonin is released into the gap, and that signal is then taken up by the postsynaptic neuron. Prozac prolongs the life of serotonin in this gap. That may seem like a good thing, but it's really manipulating nature. So imagine there's a friend that you like a lot, and the friend comes over to your house and visits. But one day, because your friend has troubles at home, your friend decides, I like it here, I like it with you, so I'm going to stay here. And so the friend, with her suitcase, goes into the living room, unpacks her stuff, she's sleeping on the couch, and 2 days later, something that you liked, the presence of this friend, becomes unbearable. So your body is like that too. So if you have serotonin hanging out in this gap longer than it should be, just like how you respond to the neighbor, you want to start pushing her away, or you don't let her in, this postsynaptic neuron will stop responding to the serotonin. When you manipulate nature, sometimes you have to do that, but if you do that long term, you're really creating imbalance in the body. Different neurotransmitters accomplish different jobs. Acetylcholine helps with cognition and memory. If you're depleted in serotonin, then you start losing pleasure in things that used to be a source of enjoyment, whether it's food or relationships or activities. If you have low dopamine, then you'll start losing motivation. You'll start feeling worthless. You want to avoid people because you don't have self-respect. GABA is the one that calms you, so if that's deficient, you'll start getting anxious and worry about things you didn't worry about before. One of the primary determinants of how well balanced the neurotransmitters are is your sugar regulation. If you have good fuel delivery, sugar and oxygen, neurotransmitters are going to be that much better. There's many patterns that can create an imbalance in neurotransmitters. Different medications, as I was describing. A lot of these are made in the gut, so if you have bad gut flora because you've used antibiotics a lot, that will be affected. B vitamin, magnesium, iron deficiencies, anemia, poor liver function, what are called excitotoxins. So these are chemicals that we ingest in our food supply, like aspartame or glutamate, MSG, that disrupts neurotransmitter balance. Eating foods you're sensitive to, situations where your immune system is attacking parts of your brain or your gut, that can disrupt neurotransmitters. Hormone imbalances, leaky blood-brain barrier, deficiency of amino acids, and inflammation. Hormone imbalances affect brain function. Estrogen impacts serotonin in men and women. Again, that's the pleasure hormone, pleasure neurotransmitter. Hormonal imbalances can cause depression, sleep problems. Estrogen also impacts dopamine and acetylcholine receptors in women. So if your estrogen levels are fluctuating, you could have a lack of energy, lack of drive, lack of feelings of self-worth, or poor cognition. Progesterone impacts GABA in men and women, so if that's low, you could start feeling nervous and anxious, sleep problems. Testosterone impacts dopamine, acetylcholine in men, so low dopamine, no energy, can't finish projects, no drive, no passion. Acetylcholine, that's cognition. Low testosterone can affect your ability to think clearly. Thyroid hormones impact all neurotransmitter receptors in both sexes. So if you have low thyroid function, then all of those neurotransmitter functions can be disrupted. So again, we're talking about one part of the body affecting another, and you can see how it's all intertwined. It's very holistic. So remember that hormones are produced from cholesterol. So if you're on a low-fat diet or eating a lot of bad fats like fried foods and saturated fats and processed fats, as found in processed foods, then you don't give your body the materials it needs to make hormones and the tissue of your brain, which is primarily fat. 60% of your brain is fat. Vegetable oils, hydrogenated oils, make membranes of nerve cells rigid and unresponsive. We need a proper omega-3 to omega-6 ratio to avoid inflammation. Omega-6s, again, those are the vegetable oils. Omega-3s, that's flax, seed oil, fish oil. We want to be ingesting at least 5,000 milligrams of essential fatty acids, good quality omega-3 and some omega-6, but not excessively. And then finally, we need to keep the brain exercised and active. Physical activity, any form of exercise, walking, accomplishes that. Mental activity does. But in our office, what we do is targeted brain exercises. So if we determine that your cerebellum is fatigued, there are ways that we can exercise that based on its known function. So balance and coordination, we can have you do coordination exercises, like touching the dots on the wall or standing on a platform that vibrates, very stimulating to the cerebellum. First, we have to identify what part of your brain is most compromised, then we target that area with brain-based therapy. Okay, gravity, being upright in gravity, the muscles are working to maintain balance, and that's firing off those nerve signals that feed our brain. And touch, physical touch, very stimulating for brain function. And here's a list of some of the brain therapies we use. We can exercise your brain by moving the eyes. In fact, I want to show you something here. Place your hands on the neck like this. And what I want you to do is not too much pressure, just light pressure. I want you to move the eyes left and right, up and down. And as you do that, you should feel subtle movement in the neck muscles. And this is because, remember I talked about hardwiring earlier? The nerves that move the muscles of the eye are hardwired in the same area of the brain as the muscles that stabilize your spine. We very often use eye exercises in order to improve spinal muscle tone, but it also fires up that common area of the brain. Eye lights, those are glasses with colored lenses and lights that flash to stimulate weak areas of the brain. Nonlinear complex movements, so it's like this kind of movement, circular kind of movements. That's very stimulating to the brain, especially the cerebellum on the same side. Balance exercises I was showing for cerebellum stimulation. Timing and rhythm exercises, that's your frontal lobe. So a person that has poor timing, like can't tell a joke, has poor frontal lobe function. So to entrain that, we might have you doing exercises, finger to nose exercises, in keeping with the metronome. So each beat of the metronome, you're moving in time with that. So that's working the frontal lobe. Yoga, massage. So there's many ways to activate those nerve pathways that ultimately feed the brain. One of the most valuable tools we have for decreasing brain inflammation and healing that brain barrier is called microcurrent. So this is microamps or millionth of an amp of electricity. It allows us to input into this channel frequencies specific to tissues like frontal lobe or cerebellum, inner ear, or a nuclei in the brainstem that is about regulation, salivation. And then in this channel, we can input frequencies for conditions affecting those tissues, like inflammation or shock and trauma or excessive activity or viral or bacterial or fungal infection. So we use this a lot in terms of brain function for reducing brain inflammation. Then we recently added neurofeedback. It's like biofeedback for the brain. And the form we use is called Brain Paint. I was talking earlier about the fact that your body has an inbuilt inherent healing potential and actually drive and compulsion to be well. That's true of your brain, it's true of your whole body. And that's so deeply ingrained in your nerve tissues that all we have to do is show your brain an image that represents its current function. And if its current function is less than optimal, your brain, in seeing that reflection of its function, will automatically make changes to improve its function. So that's what brain biofeedback is. The form of brain biofeedback we use is called Brain Paint. You're hooked up to the software and the hardware with metal clips that go on the ear. Nothing goes into your brain. Those are just to record the waves that your brain is producing during the session. So you're looking at the screen, computer screen, and you see what are called fractal images. These are beautiful nonlinear patterns of colors and shapes, and also there are sounds coming from the computer. And these are a present time representation of your brain's activity. And as you're looking at it, your brain is seeing a reflection of its function, and it wants to be better and do better. So it automatically makes changes to upgrade its function, just based on what you're seeing. So the research on neurofeedback has been around for a long time, and very compelling research. Lots of studies showing the value and benefit of neurofeedback. In fact, studies are now showing that neurofeedback will change the gray and white matter of the brain. It actually changes the structure of the brain. If you do enough sessions, then improvements and changes are permanent. You don't regress. The people who run the organization wanted to get real detailed information about how much benefit this therapy was delivering to the people that use it. So they did a survey of the records of over 13,000 patients who had been treated with this modality. Of course, these people were being treated for a wide range of conditions, and all totaled, for all those conditions, after 2 sessions, 45% reported improvement. After 5, 63%. After 10, 74%. After 20 sessions, 80% reported improvements. The conditions that responded the best to Brain Paint: post-traumatic stress disorder, after 20 sessions, 89% reported improvement. Nightmares, 85% reported improvement after 20 sessions, and with insomnia, 79%. There are many other conditions, though, which had very favorable outcomes. Autism, Asperger's, 78%. Depression, chronic pain, OCD, fibromyalgia, migraine, schizophrenia, bipolar. It's used for traumatic brain injury and quite a few other conditions as well. The majority of these patients were treated with the Brain Paint only, not with the metabolic support and brain-based therapy. So when you add the nutritional body chemistry support and the brain activation, then these numbers would be even better. Summary: what does a healthy brain need to thrive? Proper fuel in the form of glucose and oxygen, proper neurotransmitters, brain chemicals, proper activation or exercise, stimulation, and an inflammation-free environment. So the final success story, this is Charlene. I'll just read what she had to say. I was experiencing problems with seizures, brain fog, tight jaws, painful hips, legs, and lower back pain. She had been to a neurologist. His solution was anti-seizure medication. I said, no way, medication is not a cure. Smart lady. I suffered for 6 months. By the time I was having 15 to 20 seizures a day, I started care in this office. After 2.5 months, the seizures were down to 0 to 2 times a day. Spine is becoming stable. Hips and low back are beginning to hold their adjustments. Jaw pain, brain fog have improved 70%. Overall condition 90% better. So we treated her with a combination of all the stuff we've talked about tonight, except for the neurofeedback. We didn't have that at that time. The body has a tremendous inbuilt drive for health. And if you get out of the way and provide the body what it needs, healing miracles are possible. Okay, so I want to talk to you about the Brain Restoration Program. We've really been talking about that all evening. So this is the offer that I mentioned earlier. So if you like what I've been sharing and you want my help with your brain health, then these are the steps. On visit 1, we do a complete neurological evaluation Whatever lab work you have from the last year, bring that in. We'll evaluate it. We'll have you fill out questionnaires similar to the one you filled out tonight. You get a copy of the book that I've been referencing all night, Dr. Karazian's book. And the title of the book, by the way, is Why Isn't My Brain Working? And then if you're married or have a significant other, it's helpful if that person comes with you to that first visit. Then between visit 1 and 2, I look over your lab reports, your questionnaires, the results of the neurological evaluation, and decide if we can help you, if you're a good candidate for what we do. And if you are, at visit 2, I tell you that, and I also tell you what the results are of the neurological exam. I tell you if further lab testing needs to be done, and then I give you an overview of treatment, what we're going to do to help you, exactly what procedures, how many visits, over what period of time, and of course what the cost would be, including what your insurance might cover. And it's important that the spouse attend that visit. In fact, we only do it if the spouse or significant other attends that visit. Wear shorts and a t-shirt to that visit because we do the neurological evaluation. And if you don't have the paperwork filled out when you come, then we have to reschedule it. Normally these 2 visits are $250, but because now you're educated, you have all this background information, we discount that first and second visit offer to $49, and that includes, again, the copy of that book. Then if I feel that I can't help you at visit number 2, or possibly visit number 1, I tell you that, and then we refund that money that you've paid. In order for us to work well together, though, you have to be willing to make serious life changes, you have to take full responsibility for your health, and you have to understand that insurance, including Medicare, only pays a portion of this care. So you're going to have to pay something out of pocket. If you have no insurance and you need to make payments on installment, we work with financing companies, and most of our patients can get the care they need if they finance the care with payments between $200 and $400 a month. So the care is affordable if you value it enough. For anyone with a chronic condition, including brain function, consider on a scale of 1 to 10, how serious is your problem? How has it affected your relationships, your work, your ability to enjoy your life, not just now, but 5 or 10 years down the road? On a scale of 1 to 10, how serious are you about eliminating your illness? Due to time constraints and a very low frustration threshold, I only work with people who are serious about their health. Thank you very much for your attention. Hopefully you got some information. But understand that knowledge by itself is not useful. It's acting on the knowledge you have. That's what gives you the power.